Talk SME Essentials brought to you by Tally Solutions. Joining us in the studios, Mr. Pavan Sharma, founder, MD and CEO, First Response Healthcare. Also with us is Prashi Sharma, Chief Strategy Officer from First Response Healthcare. Before we went to the break, काफी कुछ interesting बातें पता चली about First Response Healthcare. But I wanted to ask you, Pavan sir, that it's such a big competition for you जब हर घर में कोई ना कोई एक डॉक्टर बना ही है, तो ये कैसे आप टैकल करते हैं?
See, it is again depending upon the market. So there are places which are highly regulated. Okay, like for example, it's very hard to get an antibiotic without prescription in Dubai. But it is very, very easy to get an antibiotic in, I will not name the countries, okay, but you get it. Okay, so it definitely impacts the your body system. Okay, creates resistance which are not good for the people. But how we handle it is here, we are giving the convenience to people. We are giving them the accessibility. I mean, people can call us and we are there in 30 minutes. So there's no rush to take some self-medication, understand? So that solves the problem. And for us as a first response, we have two USPs when we started the business. One is reach on time and give a quality healthcare delivery. And I think these two USP need not to change. So they will continue as it is. We need not to invent any new USP for FRH to be successful. Once you are reaching on time and giving a quality treatment which is solving the problems of the patient, you don't need any third USP. So I mean, FRH is based on these two and it will continue. And it will resolve your problem of the self-medication as well. Because people have started trusting. They have started trusting that if you have some problem, 30 minutes, symptoms are going to be relieved. So that is where the trust has been.
Prashi, my question to you would be, you being a second generation entrepreneur, what has been your biggest challenge, you taking on the foot of your father, Mr. Pavan, and also getting into the first response healthcare? I'm sure you must have encountered some set, kind of challenges, blockages. How do you think you've been able to take on that role?
Okay, I love that question because when I started out, I think the biggest challenge was, there were two challenges. First was earning the trust and respect of the team members already there,
Right.
Because you don't want to come in with authority and entitlement and try to change things. You want to be there, deliver work, and then make it a collaborative effort with everyone. This was an experienced team of more than 6 years. They had their own ways of working in a certain way. So you don't want to change or disrupt anything. So my approach was always to first listen. Like for the first 2-3 months, I only did the listening and no talking.
Okay.
To build that relationship with the people who are already there, because I think everything is a team effort. I can't do anything alone. And the second challenge was that how do you bring in new, how do you build on the legacy? You don't want to just take the legacy, like inherit the legacy, you want to take the legacy forward. So how do you bring in new solutions? How do you do the market research? How do you ensure that the company is staying up to date with what's relevant, with how the customer segmentation is changing, with how the consumer behavior is changing, and bring it all together. I would say that were the two biggest challenges for me.
That's wonderful to hear that, you've progressed very well and wish you all the best. Vivek, I'm sure you have a lot of questions in your mind.
सबसे पहले तो थोड़ा सा ऑन अ लाइटर नोट में जानना चाहता हूँ कि ऐसा होता है दैट ऑफिस में बिकॉज यू हैव अ बॉन्ड ऑफ फादर डॉटर, तो वो अनबन हो जाती है. पापा आपको नहीं पता आजकल के जमाने में ऐसा होता है आपके साथ?
ये होता है.
And of course hota hai, and that's where drawing boundaries comes in.
Right.
Personal is personal and professional is professional. Very important to be professional. I call him Mr. Pavan in the office.
Yeah.
So
अच्छा, you don't call him dad. Okay. और ये रूल किसका था? कुछ रूल सेट किए हैं कि हम घर की बातें ऑफिस में नहीं करेंगे?
No, this is not. There's no rule like that because, as I said, I have two homes, one at office and one at home, and my half life is here, half life is there. So I'm always at home. I mean, so that is so they don't feel that kind of difference. They are free to talk.
and I'm the bridge between
And,
the two.
Good point.
ये अच्छा है दैट घर पे ज्यादा टाइम अगर आप काम पे बिजी हो तो सारे घर वालों को काम पे लेके आ जाओ. वो भी एक अच्छा टेक्निक है.
I mean, it is built now that the patient and being in healthcare, like I'm on 24/7, for example. You have to give one thing as the top priority. You cannot have two things at top priority. Okay. So that is inbuilt, like we all have that priority. If anything is coming for the patient or the company, then we leave everything and then focus on that first. And then, yes, discussion. So that's why
Yeah.
I cannot detach that I'm at home or I'm at office. She is facing some problem, she will immediately come to me whether I'm at home or at office. So it doesn't make any difference for us
Oh wow.
as a location.
Right. And Prashi, what are the things that you've made sure that this doesn't come in between? That boundaries that you've set that creative, that that he's your mentor and we should approach him in a way.
No, 100%. So, as I mentioned, the start was just taking in everything that he has built in the last 6 years, understanding all departments, not questioning them, making sure that whatever I say is informed and backed by logic
Yeah.
and not just by instinct. So, those are the boundaries that I'm talking about. That maintaining the boundary between respect, but at the same time, making sure that what you are thinking is also implemented because you're giving the logic behind it.
Yeah.
So that can involve some debates, but at the same time, it's healthy debates.
Yeah, these are healthy debates.
Yeah.
And one point, like so for example, her role is not limited to X. Okay, her role is to optimize things. Okay, create strategies around everything. So be it even a price policy or a promotion or a customer experience. So, and she is very active in all those departments. So what happens is, if she is sitting in a call center, for example, so maybe I am seeing this for last 6 years.
Right.
I may miss few points, understand, but she is looking at from a new perspective. So some points comes up. Now even with those points, if I can make a difference of 2 minutes, so rather than 26 minutes, I'm reaching in 24 minutes, for example, it makes impact to the patient. So that is where the role is very, very critical to see what I cannot see, for example. And also with new generation, like their thinking process is entirely different. So I
Grasping
think-
power bhi zyada hota hai.
Yes. And then you see a lot of things which create space into the system. Okay. So that is what we are experiencing. Sometimes I'll say focus on one thing, okay, but she's
All over.
spread. Okay. So
all rounder.
yes,
Yeah.
all rounder. So I mean, it's going well in terms of growing the organization and building a right organization.
Right, we'll discuss more. अगर आपके पास सवाल, you can always get in touch 0586861003. आप हमें WhatsApp कर सकते हैं, या you can call us 808-1003. Pavan sir, is there a first response for the kind of accidents that happen? I mean, the way Dubai police also reaches and clears is phenomenal. Is that one of the inspirations for you also?
See, we work like so this first responder. So if from Dubai ambulance service, there's a first responder. Their expertise is they reach in 15 minutes, okay, and address need. Our name first response is somewhere inspired by what the government is doing. Rather than writing something doctor on call or something, we believe that name we should live with. The first response means we will be the first to respond to you, and that is where we are into the picture. Now coming to the accidents part, I think these are the cases of critical emergencies. Now when we say critical emergencies, we are not dealing with critical emergencies directly, but we help patient to reach to the right location. In case they need it, we help them. So for example, if we go to treat a patient and we do our own trials at the call center to understand what is the problem, and maybe out of 100, maybe 1 or 2 cases we find that it's not the mild emergency, it's a critical emergency, then immediately we don't want to waste time. Then we tell patient to call ambulance and go to the hospital. There might be 1 or 2 cases where we reach, could not identify on phone, and we reach and we find that there's a critical emergency. Then also we arrange the ambulance, we shift the patient, okay, and the ambulance, and then we have the tie with the hospitals. So that patient goes to the hospital and managed. So it is not that we only deal with the primary care cases, we also help patients manage their critical emergencies, and our teams are in touch when patient is in the hospital. So anybody who called us Means we are end to end. We take care of the patient till the time that patient is well and reached home. So that is how. Even we deal so many tourists, they go back home and then their doctors are connected with our doctors and then follow-up treatment continues. So our services are till the time patient feels better, and then and that is the credibility. I mean, today we are leader in this segment because we don't treat them as a one-time activity. Patients are connected with us for a lifetime, and that is where focus is.
Mr. Pavan, what was the turning point that you had that you took that leap into launching into the first response healthcare? Because this is a very critical segment in terms of the healthcare industry. What made you? What was the experience that got you prompted?
Yeah, it's a good question because see, being in healthcare, and I have worked in hospital, pharmacy, diagnostic. I mean, almost all the verticals.
Right.
And I always focus that how. And it's not that when I started my company, I started thinking like that. Okay. Sometimes people say that first make me manager, then I'll behave like a manager. And my saying is that first you behave like a manager, you will automatically become a manager.
Yeah.
Okay. So it is not that I started thinking about business when I started. I'm doing this for everywhere. Like, whatever jobs I have played since the first job, my focus is always to build something. I mean, create some impact. Okay. Build something which is visible to people, understand, helping people. So in that context, I always keep thinking what new, what next.
Okay.
And once I visited Dubai, I have seen the country. In India, I have seen, suppose, visiting a hospital, visiting a hotel, seeing tourists. So I think all dots got connected, and then I keep my eyes and ears always open. So listening what is happening around the world. Then it clicked that there is a pain point for tourists. Like whenever they go any place, it's very difficult. We have also faced those situations when we traveled and fall sick, taking our own medication. So that was the triggering point that we should do something for the tourist, and there's no better place than Dubai when you want to address the tourist problems. But once we started, and then how it started is that we started talking to the hotels that what you do when any tourist falls sick.
Right.
And then we have understood they are also facing challenges because there are hospitals, there are providers, when they call, then somebody is reaching after 3 hours, 4 hours. Now guest is calling at reception 100 times. It's creating panic. Now that relationship, this reception is calling the provider, they're not responding. I mean, not the professional way of dealing things. And that is where we thought that let's create something which is very, very professional and very quality oriented. And that is why the TAT was the first thing, because reaching on time gave the confidence to the client, and treating patient right gave the confidence to the patient. And these are the two connecting dots for us. And then we did it successfully.
Amazing. There is so much to learn, so much to know, and of course we have Prashi and Pavan sir in the studios. We'll talk about risk and growth, we'll talk about agility strategy, financial backbone, decision making framework, all this lined up in the next half an hour. अगर आपके पास कोई भी सवाल, you can always send us a WhatsApp 0586861003 or give us a call 800-81003. This is Talk SMEssentials brought to you by Tally Solutions. 9:37 Vivek और निकिता आपके साथ. This is Talk SMEessentials brought to you by Tally Solutions. And yes, Prime Cloud Access, Tally Prime Cloud Access के बारे में आपको बताएंगे थोड़ी देर में, लेकिन कुछ का एक वॉइस नोट आया है, वो हम पहले सुन लेते हैं. क्या कह रहे हैं वो?
Why not we keep one doctor, one healthcare consultant in every property of the hotels? Very curious, got sick or having health issues, so they can immediately, they can contact to their hotel itself. And after that, after giving the first aid, then they figure out that it should be toward to the, hospital, or it could be cured at the base itself, So rather call ambulance, rather call a lot of things,
तो आपके दुकान बंद करने की बात कर रहे हैं. कुछ क्या कहना चाहेंगे पवन सर?
नहीं बंद नहीं कर रहे. I think he is giving the right suggestion. But just to give you a brief that we have 43 nurses already deployed in different hotels in Dubai, and I wish that I will be deploying each and every hotel with a nurse. Now it goes as an escalation. Like for example, how you check your heart problems. For example, first you check the blood pressure, right? And if blood pressure is abnormal, then you go to ECG. And if ECG is normal, then you go to 2D echo or angiography. Like it's a escalation. Same way healthcare problems. So any healthcare problems like first aider in the hotel can check that if any abnormality is there which is not manageable, then they call us. Then our doctor's team goes there. And then doctor's team, if they are not able to manage it, then they call ambulance. So it is not that for any minor major problem you just call the ambulance. It is again the capacity utilization. You are taking ambulance at the cost of some emergency patient. So I mean, everybody has to follow a proper escalation matrix, and we are setting it right, especially in terms of the hospitality business here in Dubai. Not only Dubai, we are present in Dubai, Abu Dhabi, Ras Al Khaimah, Qatar, and we are moving to Saudi. And in all these locations, we have that leadership defining the healthcare, because hospitality team, they are very good in what they are doing. When it comes to the healthcare, we become their integrated partner, because the guest health and the staff health both are very critical, and we give them end-to-end understanding and management from our side. And that is why we are the preferred partner for all the hospitality players in the market.
Right, first response healthcare, amazing initiative आपका पवन sir, and Prashi, I must appreciate. We got a question from PB. वो पूछते हैं कि which areas of Dubai do you operate and how do you manage 30 minutes with traffic issues? Now, if you're not handling ambulance-based emergencies, 30 minutes fixation needed. I'm someone whose heart goes out to the accidents faced by delivery riders due to time pressure. So, काफी सारे layers है इस question में, अगर आप answer करना चाहेंगे.
So how we reach? So for example, today we see a lot of traffic in the city.
Right.
It was not 3 years back, 4 years back. Correct? We used to reach in 30 minutes average time easily. Today, when we have seen this changed, we have changed our system.
Okay.
So my teams are located in 4 different locations.
Oh, nice.
I have different clinic in one part. I have different clinic in other part. Otherwise, these clinics, we don't operate in clinics, but these clinics are with some of the other partners. For example, EMAR as one of the clients.
Yeah.
Okay, we are doing EMAR for last 5 years.
Right.
So we have a clinic which is in the compound. For
Okay.
example. So my team can operate, my team can be around. Okay. So likewise, we divided the zones and we look at that how much time, how much radius we need to reach within 30 minutes.
Amazing.
So I mean, the USP is 30 minutes. USP cannot change by changing of the environment. You have to change the way you are operating.
Amazing.
So that is how we stick to our USPs and don't change because of the external factors.
That's lovely to hear. Mr. Pavan,
The
taking
other
you-
question part that delivery drivers अगर accidents या कुछ उनको face करना है, again probably इनको नहीं पता that you don't do critical or major response.
Yeah, so that is, I think the answer is same. Accident of any kind. Okay, we are not going into that because there are certain laws also. We have to follow some DHA guidelines also. We are into the primary healthcare.
Okay.
But yes, obviously, if for example my team is around and something happens, they are there to help. I mean, we always help people to reach the right location or right facility.
So, Mr. Pavan, my question would be about taking you back your memory lanes when you first started engaging with your customers and winning your first set of customers. In a market like UAE, how do you convince people who are not ready to give out a call to a first response immediately, rather, and how did you convince your first customers for first response?
I think this is one of the message to everyone that when you have when you start something, okay, you have to be on your toes all the time, understand? So what we were waiting for, one call. I mean, you cannot miss it. So one call and you are reaching in less than 30 minutes, okay? You are changing the experience, understand? Now you understand this, suppose one hotel was calling somebody and that doctor was reaching in 3 hours. And all of a sudden you requested after a lot of follow-ups for one call and you reach in 30 minutes. Is he going to call the previous one? No. So, I mean, your work speaks. Like, I always remember that 2 words, work works. So, your focus should be on delivering what you are committing. And then I don't think that client is a challenge. we have today a lot of word of mouth coming to
Yeah.
us, like hotel to hotel referrals are there, patient to patient referrals are there, and they believe, they trust that we will reach on time. So coming to your point, so first client for any organization is the employee. Okay. Now, how you get the right set of employee shapes the organization.
क्या
The
बात
first team is very, very critical. Okay. I'm proud to say that we started the company with 16 people,
Oh wow.
Nice.
and 14 people are still with the company
अरे
after
क्या
6 years.
बात है, such a big achievement आज
So,
के date पे.
yeah. And two I know left back home because of family emergency. So that is the right team. And then when you have a right team, they know how to get the client. You know, people trust each other. Okay, suppose I have taken a business development person, and he is from the same relevant field market, has credibility. That is our job to find out the right fit for the organization. And at each stage of the organization, you have a different requirement. Sometimes you just need an initiation. Sometimes you need a skill. So the choice of the person will also change over a period of time. But at the start, you need the person who is honest, trustworthy, have connects, hardworking, because that is what is required. Smartness comes later, but first you have to reach to the people. Understand? So that is how we started, and we got a very quick response from the clients because we never missed a call reaching more than 30 minutes. And that was the biggest pain point with the people to call us. Understand? So I mean, that is how the journey started. And I always tell the team that people need to understand why they are there. I mean, if I can handle the entire organization, then I don't need any team members, right? So problems are there. That is why we are here. If there is no problem, then why is anybody is required? Like we are solving each other's problem. If you look at personal, professional, anything in the entire ecosystem, basically we are solving each other's problem.
तो हम सब entrepreneurs हैं आपके हिसाब से.
All. If you are solving a problem of someone, you are in the same category.
क्या बात है. Beautiful. You know, the vision, the thoughts, and the entire concept is so amazing. And Prashi, I must say that कि this was a no-brainer to join Dad's company.
100%. That's why I'm here.
But yeah, we must ask you also, balancing fresh ideas with existing business wisdom. You didn't mention a little bit about that, but I'm sure you're bursting with ideas now that you've been from the inception of First Response Healthcare.
Right. So as I mentioned, the first 2-3 months were a lot of learning, and then we got into action. So I believe that legacy brings in a lot of stability, but you have to innovate to keep growing, right? So that involved a lot of strategies, discussions with relevant team members, with Mr. Pavan on first, let's say, how do we bring in technology in all of this? How we smoothen out our internal workflows, because some things technology can do better than us. How do we improve the patient experience through technology? So these are the things that I've been actively working on. Then came in new products and services. So as he mentioned that we've developed personal connect with the patients now, So we want to cater to all healthcare needs of that patient. So if a patient needs a home care nurse for her father, let's say, then we want to be able to provide that. If they need a physiotherapy session because they have pain, we want to be able to provide that. If IV therapy is something that everyone is taking today for energy and vitality, we want to be able to provide that. So it's about developing those new services, staying in the market with the right products and services so that the customer keeps coming back to you, and they just need one number as their healthcare helpline. Expanding into new locations, looking at different healthcare verticals which we can cover, being their primary care provider, be it mental health, be it weight loss, be it different things. So these are some things that we are thinking about working on as we speak. And that's where I come into the picture in optimizing things.
अरे इतना कुछ काम कर लेती है प्राशी. पवन सर,
बहुत ज्यादा करती है.
आपने एक्सपेक्ट किया था कि ये सारा जिम्मा जो है ना ऐसे आगे बढ़ाएगी वो?
ये तो बचपन में दिख गया था. क्योंकि I mean office is later, but you also see leaders at home. So you see somebody taking decisions, somebody convincing people understand. So you understand that how will be the professional journey. So I can say that she has those mindsets, and it's I can see now in the office.
As a kid, I loved going to his office and just sitting on his chair. And I think that was his first sight. But now I've realized that you have to earn that chair. So working towards it.
Awesome.
Sometimes you don't need to, for example, don't need to read, or it's an influence. Like, if you like someone, automatically, things started. You start following that.
Yeah.
Okay, it's influence. And so in my career also, like, I have few people where I just see and then I'm just copying. For example, it happens. You don't need to read books for that. So I think in the family also we have that kind of, we know each other and then learn from each other.
So we'll continue the conversation financial backbone के बारे में, because आपने कहा था कि 16 लोगों से आपने शुरू की थी कंपनी, तो इसके बारे में और थोड़ा फाइनेंशियल एस्पेक्ट भी जानेंगे. अगर आपके पास कोई भी सवाल, you can always send us a WhatsApp 0586861003 or give us a call 800-81003. This is Talk SMEssentials brought to you by Tally Solutions. 9:53 on the clock. Malik Nikita आपके साथ. Now, cheers and congratulations to the entire team on yet another remarkable achievement. Now, Tally has been honored with the Innovative Accounting and Tax Technology Award by Finance World Magazine in the UAE. तालियां तो बजाइए निकिता. And also joining us in the studios, we have Pavan Sharma and Prashi Sharma, First Response Healthcare. Couple of minutes left, but yeah, let's talk about the financial backbone. Managing businesses, your finances efficiently, it is key to sustainable growth. Your story, Pavan sir.
Yeah, I think for any business, and especially the startups, okay, you have to focus on finance and the team. I mean, HR and finance are my favorite departments because they build, shapes the organization, and especially in the finance, people, whenever something is going positive or negative, the decision making is very critical at that stage with the finance side. So, updated with the real-time numbers and analysis and reports makes a lot of sense. But I'll request Prashi if she can highlight a little more on the finance, because finance is also a favorite subject for Prashi.
No, as I mentioned that any business decision has to be guided by your finance. It has to, because that's how it will be sustainable, and that is what has been happening in First Response, that we rely on solid reporting, solid financial data to be able to take our decisions, and that's why we have been using even Tally Prime, for example, since the first day, since inception. And what I absolutely love about the software is how it has adapted to our needs, So when we started out, of course, team of 16 people, smaller needs, so you use it for core accounting, you use it for basic purposes. But now we've grown to more than 4 locations. We have more than 250 employees, so the software has to grow, right? And it has done exactly that. It's a very incremental software, so it has now we use it for inventory, for payroll, even project planning, what type of financial needs a project has, budgeting, analysis, and what I think is the favorite part for Mr. Pavan is the owner's dashboard, where that's what he wants to see. He doesn't want to get into the nitty-gritties, but he likes to see that the financial standing of the organization, and that is what it does beautifully. Also, the fact that it is updated with the local laws, so corporate tax coming in, it's updating itself regularly.
See, when you are focused, like, you should focus on your core business. So what happens is, suppose you have some softwares which can take care of finance, which can take care of your HR, or which can take care of other things. You are done. Like, you have more time to focus on your core business. And then if you have like she said, that you have a scaling in those solutions, it makes life more easier. So for example, now we have multi-user account, okay, we have the online access. So even my team sitting in Qatar, for example, they do it, and then we can access from here. So I mean, you need this kind of supports, because your focus should not be diluted, and that is where it is. Yes.
We're out of time. Like, quickly, 2 questions I'm going to ask you. Let's start with Prashi. Your advice that you want to give to young professionals who are stepping into family businesses.
On your place, don't expect it. First,
कितना मुश्किल है बोलना इतना आसान है.
100%. And second would be try to develop your own leadership style. What happens is that when you've seen a leader so closely in your family and professionally, you try to mimic that, you try to copy that, and nobody likes it because it's not authentic to who you are. So try to find how you want to lead, how you want to bring about changes, and learn while doing it. So learn on the go. So yeah, that would be my advice.
Excellent. Pavan sir, your one key takeaway for aspiring business owners?
I think delays should be avoided. Like you'll find many people who keep thinking that they want to do something, okay, and then they delay it. That is one. Second, keep one focus at a time. Core focus. I mean, you have 100 things to do, but your one focus can supersede everything. So that should be the approach, especially in the first 2-3 years till the time you reach that stage. I mean, make it happen. That kind of determination, because I believe that desire drives everything. You should have first that real desire to do something, and that is what it makes all the difference.
Before I can let you go, Mr. Pavan, what is your next vision for the 5 years coming up? And for first response healthcare, where do you see it expanding?
So I'll tell you that we are a primary care player. We want to be global, and this problem is global.
Yeah.
Now, what I want is, like as I said, that if you have last 10 visits where 1 or 2 times you needed a critical emergency, that means 8 times it can be fixed at home. So the focus is 8 times you cannot have maybe the home visit. So use of technology. So tomorrow with the use of AI, ML and everything, maybe 4 times it will be treated through a tech solution. 4 times you need a home visit, and 2 times you have to go to a hospital. This is going to help the governments immensely to control their healthcare infrastructure budgets. I mean, today these places are occupied with the primary care people who can be fixed at home. That has to be avoided. So my focus or the vision for the FRH is you want to rebuild robust system for the home visits, at the same time create something which is on your mobile, can take care of 50% of the problem. So for example, if you tell 3 problems, mobile will ask 3 more questions, a prescription can be generated, goes to pharmacy, in 15 minutes you get a medicine. Why this same Blinkit model cannot be in the primary care? Are you understanding?
Yeah, super method, and I
That
really
is
like
the-
that perspective
Yeah.
also.
So the vision for FRH is to make it more simpler and make it global.
Amazing. It has been such a wonderful conversation. How can people get in touch? First Response Healthcare on the website, social media?
The best way would be our 24/7 call center that equipped to handle any of your on-site healthcare needs. The number would be 050 50 50 387. So it's a simple number for any of your.
Thank you so much. It was such a pleasure, and more power to you, sir. You're doing a wonderful work, and keep mentoring the entire world and keep saving all of us.
And the best wishes from our side to you, sir.
Thank you very much.
Thank you.
Thank you for
Thank
this
you,
time.
Prachi. Thank you.
opportunity.